It sounds like in your world, just like in mine, burnout, compassion fatigue, this is just as relevant, just as prevalent. That's the word I wanted to use. Um, yeah, so I know now it's like I feel like there's like it's always either new grads or older nurses like me. There's like not many in between. What have you seen? Is there a shelf life to a certain, if you have five new people, do you expect that maybe two won't make it? How's that?
Yeah, so I want to say for every four people, maybe two will last. I make a joke whenever we get a new person, like, listen, I'm probably not going to remember your name until you're here for at least 6 months. Um, I do, but it's just it's my joking way of saying, hey, I really hope you stick it out.
Yeah,
Um, I find that the money's not what they think it's going to be. They have to work a bunch of overtime to make a living. But at the end of the day, what you find out is that you decide how much money you're willing to accept. You accepted a job, and if it's not enough for you, that's fine. Go find something else to do. Totally understand that.
yeah.
But the average, so for like paramedics, for example, the average career expectancy for a paramedic these days is 5 years. Only 5.
That's how long the average lasts. Sorry, the last part I didn't hear. Okay, wow. Yeah, I mean it's not so great on the nurse front either. When you look at the statistics, I don't have them off the top of my head, but it's really kind of uncanny just how many people change their careers, especially after they've invested all the time and money into it. I think maybe people get caught up in the individual, like maybe I guess especially for your field, it seems very like a frontier, like you're a frontiersman. You're out there, you got your wits, you're with your partner. Maybe people don't realize like this is a lot of work, and you're also going to see some pretty not just tragic things, but things that really aggravate you as well. Like you're gonna the whole spectrum of emotion. I think nurses like I feel like a lot of people think like, oh, I was a great babysitter or I'm great with people and I'm going to be a nurse. And I'm like, I feel you feel more like a police officer than a nurse most of the time in the emergency department. The things that you're seeing, the things you're encountering, half the time I don't feel like a caretaker. Half the time I'm kind of just trying to like you with that patient. You want them to go somewhere, or you're trying to do what's best for them, and you're getting resistance from it. It's like you're just trying to do your job. You're fighting to do your job, and I think a lot of people get burnt out with that.
They do, and they also get burned out with the fact that you can watch any TV show, and they're making these big freaking rescues, and they're saving lives every time, and they're doing CPR on people, and people are coming back. But what they don't show you is how often it doesn't work, how often there is a negative outcome. And I think that the new people get into it with the best of intentions, but there's this illusion that they're going to save lives every single day. And sometimes the way that you save lives isn't the way that they portray it on TV. Sometimes it's by hanging out with the person that's an addict. It's
Yeah,
by, knowing the resources, trying to get them into a rehab facility, trying to get them, help. It's holding on to a little old lady's hand when she asks you to hold her hand, because why wouldn't you? Like, that's the human thing to do.
yeah.
But they don't stick around to see the good, and it's sad, but it's true.
Do you think part of it is the financial pinch that we all feel? I have met more nurses. I've never met more nurses that work 4 days a week, even 5 days a week, and those are 12-hour shifts. Or they have a staff job that's full time and they're doing local traveling. And like, I mean, I don't think people can really understand just how much this business takes from you. It's so exhausting. So for more and more people to work, like I said, a nurse working 5 12-hour shifts, it's really like kind of 13-hour shifts. You were saying you were talking about picking up overtime. Do you think part of the discontent is having to work so much, or the money just isn't what it used to be?
Oh yeah, absolutely. I think that that's one of the the bigger ones. There are a lot of people that'll tell you we don't do this for the money. Bullshit.
Yeah.
That's complete bullshit.
I, when people say that, I'm like, so you telling me if a doctor got a nursing salary instead of a doctor's salary, you'd still be a doctor? Come on, let's get real now. If a nurse got paid as much as a nursing assistant, would you be a nurse? It's like, yeah, I hate when people talk like it's a career. And it's important too that people know it's a career. So we should be getting certain protections should be in place, certain benefits should be in place, shouldn't be treated like we're so disposable. It is a career, and it's almost like it's like the master. Let's go back to like 19th century Russia, where like you're a serf. It's like the landlord is telling you you're so special, you're so good, you know, just so you get out there and you put in your work with no shoes on and no heat in your house, just so like you take it, like this filling your head with this fluff. Like what you do is so great, and it's like it comes from the heart and it's who you are, almost like so they don't have to pay you your worth.
Absolutely. Yeah. That's so we have a running joke, and I know he doesn't whenever he puts it out there, he doesn't mean it like that. But it's just one of those things that, my boss always at the end of his messages up until just recently would put thank you for all you do for the district. Which, and I know it comes from a place where he really does care and he really does mean thank you for what you do for us.
Yeah.
But it's at the same time, it almost sounds like, okay, well, I'm not paying you any money, but here's a pat on the head. Thanks, good sir. Now get back out there and do the Lord's work. God bless you.
It's like,
You know?
don't get me wrong. Don't get me wrong. I want to do good out there. I do operate. Uh, if I care very much, but when I read an article from the Yale School of Medicine that says that the 88 large healthcare companies, 95% of their net income went to stockholder payouts. And so everything that we know about medicine, at least in terms of these 88 large companies, is really just we're just watching 5% of the budget at work, whether it's to pay our salaries, the equipment, deal with patients. It's like don't feed me that bunk about doing this, from the goodness of my heart. It's like I know that you're not spending enough. You talk about nurse shortages. I know it's because you're just not hiring enough nurses. There's plenty of nurses out there. You're just not hiring enough nurses. But yeah, it's a duplicitous thing because you are doing it um, with intention and with your heart, but you also don't deserve for any administrator or system to try to take advantage of that because it is
They
a
do. They
career. So we deserve certain things.
a hospital pretty close to where I'm at. Whenever COVID happened, they were working all these hours. They were working all of this overtime. Well, when the federal money came in, the ARPA money and such,
Mhm.
what I would view as an opportunity to increase staff wages or to give them a bonus or to buy more equipment. Instead, the CEO, the COO, and a couple of other people gave themselves nice fat checks. And to hell with the people that were on the ground.
And that's part of what we have to do. We have to counter that. We have to be the human element. Like, people are coming in there. We're the ones that have to advocate for them. We're the ones that have to fight the machine. There's people that I treat, and I know you do too, who would slip through the cracks otherwise. And you have to go the
Oh,
extra mile and say, no, not this person. Like this needs. I mean, you want to talk about you had a tiff with a physician. I once told one who was it was ICU, and they just would not take the patient up, and she's after several hours, she's really decompensating, and uh, not responding well to treatment. And the physician came down again to check on the patient and asked me for an update. And I said to him, "Look, if you don't take this patient up now, they're not going to make it, and I'm going to throw you under the bus in my notes." And they took the
yeah.
patient up, and it's very, I had to get like that. But that's you almost have to become obsessive, like you as a paramedic or me as a nurse. You got to be a patient obsessed. That's a term that my wife's company uses. She's a businesswoman, but that is, or not patient obsessed. They don't say customer obsessed, but you have to be patient obsessed in this field because if you're not, you're going to miss something. And it's not okay to just go with the status quo sometimes and say, yeah, I could, we'll just outpatient that, or you really sometimes have to go against the grain.
Well, yeah, and so it's no different with us. Like when we call a STEMI alert, well, we'll call that in, and then the cardiologist will come down and be like, "I don't see any elevation." Well, it's there, and I'm telling you, it's there. I can freaking see it. I know how to read an EKG. They're like,
Yeah.
"Well, I don't know if I want to do a cath." I'm like, "Look at this guy. He's pale. He's cool. He's translucent. He's diaphoretic. Classic symptoms: chest pain, shortness of breath, nauseated, vomiting." Significant cardiac history. He's already got 6 stents. Why not take him and do an exploratory cath? I guarantee you're going to find something. Sure enough, he had a widowmaker.
Oh, Widowmaker. Yeah. Wow. I'll ask you one more thing. Because I'm having a good time with you, Jeff. I don't want to let you go, but I know you have to. One more question.